Nursing Resilience in Disaster Response by myself, Chanecia. Introduction. Disaster preparedness stands as a cornerstone in healthcare, where nurses assume a crucial role in orchestrating effective responses to multiple crises. This presentation seeks to dive deeply into the multi-phase responsibilities shouldered by nurses in the context of disaster management, navigating through each phase with the precision and care. The role of the nurse in disaster preparedness. So disaster preparedness, fundamentally a proactive approach to minimizing the impacts of emergencies, finds a champions in the front line, which would be nurses, myself. Beyond merely responding to crises, nurses are integral to the strategy planning and coordination effects that precede disasters, bringing their unique skill set to bear on the challenges presented. The role of the nurse's role in all phases of disaster. The dynamic role of nurses unfolds across the entire spectrum of disaster management, covering mitigation, preparedness, response, and recovery. So first we have preparation stage. The preparation or preparedness phase includes the preparedness phase is a crucial stage in disaster management, sees nurses as the forefront of training and education. Their responsibilities include the development and implementation of comprehensive disaster response plans, ensuring that healthcare systems and communities are well prepared to face emergencies. The mitigation phase. The mitigation phase, the initial phase in disaster management, finds nurses identifying and reducing risk within communities. Their contribution extends to assisting vulnerabilities and implementing measures to ensure overall community resilience. Examples of community-based mitigation effects include the structural, which is the building phase. So this is where you prepare yourself by building all this stuff that you prepare in the preparedness phase to build for the disaster. Then we have the non-structural phase, which includes the development of early warning systems and educational programs, and underscoring the proactive nature of their engagements. Thirdly, we have the response phase. When disasters strike, nurses become the frontline responders, providing immediate care and implementing established response plans. Triage, patient care, and effective communications become the major parts in this phase. The hands-on approach of nurses during the response phase contributes significantly to the overall effectiveness of disaster management efforts. Recovery phase. The recovery phase signifies a prolonged period of rebuilding and restoration. Nurses play a crucial role in providing long-term healthcare support and participating in the rehabilitation efforts. Also in this phase, it will have the voluntary persons like the FEMA and the Red Cross persons helping the nurses and the first responders to gather all the victims, all the dead persons that will show up after the disaster. So the mental health aspect becomes a focal point during recovery as communities work towards regaining normalized, emphasizing the holistic impacts of nursing interventions. So the community health centers and disaster preparedness. Community health centers are really important during disasters. They help the community get ready and provide healthcare when they go wrong. These centers make sure that their staff and the community are prepared by planning and practicing for emergencies. They also share important information and resources with the public, making them a key part of getting ready for and dealing with disasters. first responders. So the first responders for a disaster would be the nurses, because they would be literally at the disaster. Like, for example, like the hospitals and the health care systems, health facilities, the nurses would be the first responders. Then we will have to help the patients that probably like stuck in the hospital, to help them get out as much as they could, to redirect them in the muster points and stuff like that. The other first responders would be the firefighters, the police, the army, the coast guard, etc. The other responses would be the voluntary responders, which would be the Red Cross and the FEMA. So understanding the landscape of the first responding agencies is a provenance for effective disaster management. Agencies such as the FEMA and the Red Cross play a significant role in coordinating and executing responses efforts. Additionally, comprehending the hierarchical levels of disaster management, from local to ensuring a coordinated and efficient response. The National Response Framework by FEMA outlines the overarching structure for these response efforts, providing a blueprint for coordination and collaboration. So to conclude my presentation, nurses emerge as external in the complex web of disaster preparedness, contributing significantly to all phases of management. The ongoing commitment to training and collaboration is essential to further fortifying their capacity to respond effectively to the ever-evolving landscape of disaster. So on my next page, I'll have my resources and my references. So these are my references here.